If you're a PMHNP or FNP student, you must know your atypical antipsychotics, also called second-generation antipsychotics or SGAs. They're everywhere, on your board exams, in practice, and in patient care. Let's break them down together. So, what makes atypicals atypical? Unlike typical antipsychotics, these medications block both dopamine D2 and serotonin 5, HT2A receptors. This dual mechanism helps improve both positive and negative symptoms of schizophrenia while reducing the risk of severe extrapyramidal symptoms, or EPS, but they're not perfect. Atypicals come with their own baggage: metabolic syndrome, weight gain, and cardiovascular risk. So yes, they're gentler on movement disorders, but tougher on metabolism. Here's a high-yield mnemonic to make them stick in your memory: CLOZAR-Q. Let's break down CLOZAR-Q, your shortcut to remembering the key atypical antipsychotics. C for Clozapine, requires ANC monitoring, carries a risk of a granulocytosis. L for Lurasidone, safer in pregnancy and has a lower metabolic risk. O for Olanzapine, notorious for significant weight gain and increased diabetes risk. Z for Ziprasidone, must be taken with food and can prolong the QT interval. A for Aripiprazole, a partial dopamine agonist with fewer metabolic side effects. R for Risperidone, increases prolactin levels, which may cause gynecomastia or galactorrhea. Q for Quetiapine, known for its sedating effect. It is useful in bipolar depression. Now for some high-yield exam clues. Patient develops gynecomastia after starting an antipsychotic. That's Risperidone. Severe neutropenia requires discontinuation. That's Clozapine. Patient gained 40 pounds in a year. That's Olanzapine. Safety and monitoring are everything. Always track weight, waist circumference, fasting glucose, A1C, and lipids. Clozapine needs regular CBCs, while Ziprasidone requires ECGS for QT risk. The boards love lab questions like these. In real practice, it's all about balance. Got a diabetic patient? Avoid Olanzapine. Trouble sleeping? Quetiapine might be the better choice. Match the medication to the patient's needs, just like the boards expect you to. When studying, don't just memorize lists. Connect each drug's side effects to the patient's story. The exam gives vignettes, not flashcards. Use CLOZAR-Q to anchor memory, then build clinical reasoning on top. Want to master psychopharmacology and pass your boards on your first try? Head to LatrinaWaldenExamSolutions.com. Check out our PMHNP resources and FNP practice question test bank bundle. We simplify pharmacology into patterns that stick. Now I want to hear from you. Which atypical antipsychotic do you find hardest to remember and why? Drop your answer in the comments below.